Hello, everyone. I am Leon Kircik. I'm a clinical professor of dermatology at Icahn School of Medicine at Mount Sinai in New York City. I also have my private practice and my clinical trial center in Louisville, Kentucky. As we know, almost up to 80% of psoriasis patients have scalp involvement. And it's a very difficult area to treat. Also, not only physically, but psychosocially, it impacts patients' well-being. As you know, scalp is very apparent, and then the white scales falling off their clothes is a problem. So it's a very hard area to deal with. And the good news is, however, Zasocitinib in both Latitude 1 and Latitude 2 studies, when we look at the performed really well on scalp psoriasis, when we look at the sub-analysis, remember, these are not every single patient because not everybody did have scalp psoriasis, but out of those who had scalp psoriasis, moderate to severe, we looked at those sub-analysis, and the good news is at week 16, about 74 to 77% of the patients had scalp clear or almost clear results on the scalp PGA. And then when you take those patients all the way to week 24, they actually were able to maintain those results. Around 75 to 78% of those patients maintained their clear, almost clear scalp PGA. And this is in comparison to with Apremilast. As we know, Apremilast did actually have a good record for scalp psoriasis, and that number in those trials at week 16 was about 30 to 42%, depending on the latitude 1 and latitude 2, and then around week 24, that number was 48 to 40%. So the bottom line here is that Zasocitinib did show statistically superior results to Apremilast in both time points at week 16 and week 24.